So Protara, or the company, the drug TARA-002, it's an immunopotentiator. It's had a long history in Japan. It's in a sort of an attenuated streptococcal bacterial variant. It clearly has immune stimulating properties. Um, it's also been called, OK432. It's widely used in numerous different disease states, malignancies in Japan and Taiwan. And what really first garnered my attention was the safety and the tolerability. It has an opportunity in this inactivated form of Streptococcus pyogenes, which is a known bacterium, but it can lead to essentially what some have described as a pro-inflammatory, anti-tumoral immune effect on toll-like receptors, or TLRs. Um, so when I see something that's given intravesically that has really great tolerability, and when we're going to look at it in high-risk disease, whether it's BCG unresponsive or unresponsive, or naive, I should say. So the naives, these are patients who we can't get the BCG for, and in the unresponsive, who, if they're appropriately treated, you're looking at the the requirements of 5+2 or 2 inductions, and we don't want to proceed to cystectomy. What can I offer patients? So what we've seen in some early but really promising results with the TARA-002 is a 72% 6-month complete response rate. And I think that's really, quite impressive. What we've gone on to see a high grade complete response, basically in the BCG unresponsive and in the naive, of approximately 70% at any time. So in addition to, as I mentioned, really remarkable CRs at 3 months and 6 months with really great tolerability. Relatively small numbers. We got about 38 patients that we've reported on to date. But again, when you look at the tolerability and the safety profile, when it's all essentially instrumentation, and that the product is, can be, stored, doesn't have to be frozen, I think gives it, some very nice practical aspects in clinics, that don't have a freezer and a refrigeration capabilities. And it's kind of an off-the-shelf product with very good tolerability. Need to see larger numbers, but I'm very encouraged by both the responses we've seen in the naive and in the unresponsive high-risk group. We looked at, the total any grade adverse events, and like in any of these studies, you have a majority of people report something, but they were really about almost exclusively grade ones. Grade 2, 3s, when we looked at them, when we had a grade 1, which would have been low grade, like burning, dysuria, bladder discomfort, spasm, fatigue, blood in the urine. I mean, these numbers were really small. They were all single-digit percentage, except for the grade 1s, except for the dysuria, 13%. And pretty much across the board and everything I just mentioned, 0 grade 2s, 3s, 4s, 5s. So that tells me this is extremely well tolerated, at least in our US experience. And then, as I said, there's thousands of patients who've received this in various forms in Japan and Taiwan. So I really like that. First, do no harm when you're doing a study, but more importantly, you've got to show some efficacy. And that's what these preliminary numbers are showing us. We're seeing response rates, pretty significant response rates in the naive and the unresponsive. I think sort of the gold standard is complete response. That's really ideal, right? You don't see any recurrent disease. You can have disease-free response rates or event-free response, but if someone's going to recur and it's going to be low grade, I certainly not too bad. It's not maybe as good as a complete response. But I think those are really the kind of efficacy endpoints that we're mostly looking at. We want to cut down on recurrence that doesn't require repetitive biopsying. Simple cystoscopy, cytologies are fine, low cost, easy to manage. And then ultimately, at the end of the day, is avoiding progression and cystectomy free rates. I can't speak for the company, but I've been proud to be an investigator in this. I think there clearly is, when we've had some advisory boards, a lot of interest in combinations with approved therapies and some that may still be coming to market. So I think it's very exciting for its further interest for combination opportunities.